possibly both. So how that's done is the patient is sitting on the end of the table. You hold their head firmly, and the first step is you ask them to turn to the right, and you're going to resist them. And you are going to try to keep that head from moving a centimeter, which is impossible. You want to try to keep them from moving. It's an isometric contraction, which is muscle only, right? If it's not moving, it's not stressing ligament. Then you're going to ask them to turn their head to the left, and you're going to resist. And if it hurts when they turn, but it's not moving, if the isometric contraction, if that hurts, that would be what? A strain or a sprain?
A strain.
You sure, Jeremy? You're correct, because it's not moving. Now, the next step, let's say that doesn't hurt them. The next step, same position, you tell them now you're going to do this for them. Please relax as much as you can. It's almost impossible for a human being to relax when you're holding their head in your hands. But you have to do the best you can. So what you do then is you very gently, and about this speed, gently turn their head one way and then the other way, and you tell them ahead of time, at any time, if this is uncomfortable for you, you feel any pain or discomfort, please let me know and I'll stop. Because again, if you turn them this far and they go, ow, man, that hurts. Where does it hurt? Right in the back of my neck. That's your answer. Doing it this far isn't more positive. It's either positive or it's negative. Same likewise. It can be both. But let's think of a practical, clinical, everyday, in the trenches application. You have a patient that's been in a car accident a few days ago and their neck is really hurting them, and you're trying to decide, do I want to do a manipulation on this patient's neck, or maybe I ought to give them a few days for it to settle down, maybe do some therapies to calm it down. So if they have a ligamentous injury, do we really want to go in there and give them our best HVLA so that people in the next town can hear it? Because we just graduated, don't you know? And we can do it. The answer is no. You want to give those fibers a chance to knit up a little bit. Then controlled mobilization's good for it. But if you do it too soon, you just basically re-tear it. But if it's a strain, muscles heal so quickly, if there have been 3 or 4 days, chances are you could probably go ahead and give them a manipulation, just judiciously. In other words, let's say you don't get it to go the first time. You don't need to do it again. Just say, you know what, we're going to live to fight another day. And they may even say to you, as they've said to me, no, doc, I believe in you, or I trust in you. Go ahead and let her rip, the equivalent of that. Now, since we care about patients, we want to give them what they want. But sometimes giving them what they want is not what they need. So I'd say that this is my standard answer to those patients. You know, John, I'll be honest with you, I can move a rhinoceros vertebra if I want to, and so I could move yours. But if I treat you today like that, you will love me today, but tomorrow morning you will be calling my office cussing at me because it'll hurt like the Dickens. Because inflammation takes a little bit to build up, right? You get a sunburn today, it doesn't hurt today, it hurts tomorrow, right? Can you imagine the first people to ever get a sunburn wake up and they're all red and they, oh my goodness, I'm hurting like crazy. Wonder what the heck happened. Well, inflammation is like that. So it's okay to say, I'd love to do this for you, but I'd much rather do what you need than what I want to do. That's what you're paying me for. So we want to know. It takes a little longer for ligaments to be ready to go than muscles. That's one of the best things for the O'Donoghue maneuver. So what we'll do is we're going to practice the O'Donoghue. Any questions on that concept? Very important test. You must master it. It is such a simple test. Bless you. And you know, between me and you, it really doesn't matter whether you do the isometric first and the passive second. And I'll be even more honest with you, I did the passive first. Because if you do an isometric contraction, in contradistinction to what my pal has in his book, if you do the isometric contraction and they've got a pretty bad strain, it hurts, their neck's gonna keep hurting. It's not gonna instantaneously stop. So then when you turn their head, is it, you know, it's hurting, but did I just stretch those muscles enough to exacerbate what I just essentially provoked? So I did the passive first. That's negative, you're good to go. Then you do the isometric. So the key to this, the most common mistakes are not holding the head firmly enough to keep it from moving. It does no good to do an isometric contraction where the head is turning 30 degrees, because that's really not an isometric contraction. That's kind of like a resisted active rotation.
You mind doing a demonstration?
I'd be glad to. If somebody doesn't mind me putting their hands on their face, I'd love to. You, come on up, Al. Have a seat right here, face your colleagues. So we're going to start by getting earrings on.
No,
Okay. Yeah, you remember you got to watch out for earrings because you don't want to puncture their mastoid, right?
Mm-hmm.
So the first thing you do, some people want to do this. You don't want to get your hand in their face, just common sense. So put your hand like this. You can't do it back here. You don't want to do it up here. You just got to, you know, I'm not going to draw lines on their head and show you. You just do it where you can hold it. Now, Elle is slight, but she's athletic. So she sometimes, slight athletic people will surprise you how strong they are. So I'm going to hold her head firmly but gently, and I'm going to say, Elle, what I'm going to have you do is I'm going to have you turn your head to the right against my resistance. I'm going to try to keep you from doing it, okay? I want you to let me know if it hurts or causes you any other discomfort, and I'll stop, okay?
perfect.
So go ahead and turn your head to the right for me. Good job. Now, do the same thing to the left side. And that's the isometric contraction. Then I'm going to say, now you know what, you can relax now. I'll do this for you. Your head is, I know your brain is large, but your head only weighs about 10 pounds. So I can turn your head. Let me do this for you. I'll do it slowly. If it hurts, let me know, okay? So I'm going to turn your head slowly to the right. Let me do it. You're already helping me. If you do it quickly, believe me, their muscles will contract and you'll feel it. Because when you let go, they'll keep going. It's hard to relax, isn't it, Elle? When somebody's got their mitts on your head. And so take them to 80 degrees and you're good to go. And no, I will not get a goniometer out. I'm going to do it to the other side. And so if she says, oh man, that hurts. Where does it hurt? And she, can you point to where it hurts for me? And she points back here. We've got a suspected sprain. So I'm going to stop. And I'm going to say, well, the muscles are in pretty good shape, but she's got a sprain. I'm not going to be racking and cracking her mid-cervical region where it hurts, okay? So that's all there is to it. Make sense?
Mm-hmm.
So you can have a strain without a sprain and a sprain without a strain, but after a trauma like a car wreck, you've probably got both. So you might just treat the muscular issues rather than the joint dysfunction issues first. Let those ligaments knit up just a whisker for a few days and work on the muscles like crazy. And then start her on gentle, very gentle, active range of motion exercises as tolerated. Home care measures, avoid prolonged overhead work, put your computer up, a bunch of different things that you should have already learned in lower semesters. But we want to get, the key here is we want to treat them and not hurt them. So let's do this. Thank you for letting me demonstrate. That helped,
Thank
Fuzzy?
you.
Okay,
Yes.
You're welcome. So grab your partner, as they say in the square dancing world, and